some patients come in, and if they are complaining of pain in a specific body part and they're solely focused on that, that can be problematic because oftentimes there's a contributing factor and the pain may feel like it's in that area, but it could be originating from somewhere else. As a chiropractor, I'm very blessed to be able to look at the person as a whole. So someone might come in with a specific injury, but oftentimes there's other things that are going on. So we can't just focus on that. Of course, that would be our primary focus, but we definitely want to focus on their wellness as a whole because the body is an interconnected system. We're not just made of one part. There's many different contributing factors. So we look at if they're having, for example, neck pain, we're going to look at their shoulder as well and see what's happening as a whole, as well as delving into things, perhaps their social issues or what's going on in their life as a whole. Do they have a lot of stress? Are they getting enough sleep? So things like that as well are definitely taken into account.